When navigating the best pathway for me to take personally to achieve my long-term goals in applying to grad school, I believe that a DNP makes the most sense as opposed to a master's. Although they're both obviously advancing nursing positions, entering into more of that provider role and expertise role, I have researched and seen that a DNP is more well-rounded and invests more time and more energy into various categories such as clinical knowledge, leadership, research, overall understanding of systems, as opposed to a master's where there is an investment in further knowledge, but more specifically in a certain realm such as education, research, clinical knowledge, with less time being invested in those as it's seen through a DNP being 3 to 4 years of schooling as opposed to a master's programs being 1 to 2. I believe that in wanting to reach patients and become a provider outside of the hospital and treat patients holistically and preventatively, a DNP makes the most sense for me personally. The last 2 years of working as a bedside nurse has solidified this decision for me and wanting to treat patients holistically. This passion of mine started in nursing school and questioning if there was a way we could look at patients more holistically and not be so siloed as a healthcare system with cards and kidneys and liver and all these different teams looking at their specific organ and not as the person as a whole. I have an innate desire to look at the person as a whole and see how their different comorbidities intertwine with each other. I think that in not only working as a nurse, but also in working as a bartender in college, I have learned the importance of having empathy and carrying that with me through every shift and every day, whether at work or not. But particularly in working in healthcare, I believe it's necessary to have that and not judging patients or members of the team for their opinions, but attempting to see where they're coming from and not judging a book by its cover, but coming alongside patients and the members of the team, working together and achieving the same goal and communicating with patients, but also listening to them and where they're coming from, providing them with all the information so they can make autonomous and well-rounded decisions regarding their health. I'm passionate about healthcare and I'm driven to achieve this advanced degree in moving to North Carolina by myself and beginning my career as a nurse by myself at Duke. I went through a very difficult season of life to where I was very depressed and overwhelmed with that life adjustment, and at times wanted to pack my stuff up and move back to the Midwest. But however, I learned to reach out to others, reach out for help, create a community around me, and keep my nose to the grindstone, keep the faith through that season of life. And I'm still here in North Carolina, still at Duke 2 years later, applying to grad school. And it's hard to say that this would all be happening had I packed my stuff up and not learned to just keep going and trust the process. And I'm excited to carry that willpower and that drive with me throughout grad school, hopefully at UNCW's DNP program. Thank you.